Hello, today I will be walking you through the PMCDX provider portal. To begin, please navigate to portal.pmcdx.com. Select the Collector/Medical Professional tile. Using the credentials provided to you, please sign in. If you are a new user, it will prompt you to set your password. Enter the temporary password into the old password and set your new password. To order a test, navigate to the bottom of the dashboard and locate the requisition forms. The requisition forms are divided into three categories: infectious disease, pharmacogenomics, and genetics testing. Select the desired requisition form for the collected sample. In this demo, we will prepare an order for an oral cancer sample using the Oral DX requisition form. Scroll to Section 1, Ordering Physician/Laboratory. The physician code and the practice code will auto-populate for your clinic if there is one ordering physician per clinic. If it is not auto-populated, select the physician and practice code by clicking on the magnifying glass and searching for the appropriate selections in the name search fields. Double-click on the provider's name to make the selection. Add an electronic signature in the box by selecting the green plus sign New. You can use the pencil or select T, enter text, and record a physician's signature. To save the physician's signature, please hit Submit. Section 2, Patient Information. Complete all the light blue fields with patient demographics information. If the patient has been tested previously, select the Patient Search button and use the fields to search for the appropriate patient. Double-click to make the selection. All demographics information should populate. Review this information and ensure that it is accurate and up to date. Section 3, Billing Information. If the patient search feature was used in Section 2, the patient's insurance should auto-populate in this section. Review this information and ensure that it is accurate and up to date. To add new insurance, select the green plus sign and search for the appropriate selection in the description search field. Select the order position by clicking on the drop-down arrow in each row. Enter the policy number and group ID. If the patient is paying out of pocket for the test, select self-pay and input NA in the policy number and group ID cells. If the patient has already made a payment for the test using the provided QR code/coupon, indicate the paid status to yes. Attach the coupon with the requisition form upon completion. If you are unable to locate the correct insurance payer descriptor, select Other and enter the insurance name in the box below. Upload images of the front and back of the insurance card by selecting this box. In the pop-up window, select the green plus side Add. Select the ellipses to choose the insurance images files. Select Insurance for the category. Once finished, you can close out of the pop-up window. Section 4, Patient Consent. Collect patient consent and select the appropriate checkboxes on behalf of the patient. Enter the patient's full name and the patient consent date. Section 5, ICD-10 codes. Type in the diagnosis or ICD-10 code in the box. To list more than one diagnosis or ICD-10 code, separate by comma. To search for any code, select the magnifying glass and search for the appropriate selections in the description search field. Double-clicking will select the code and it will appear in the selected items. Then click OK. Section 6, Medical History. Enter any medical progress notes in the text box. If the patient has a family history of oral cancer, please indicate it in the fields below. Here, you should replace other cancer with oral cancer and fill in the fields accordingly. Section 7, Test Panel Selection. Choose the desired test by clicking on the checkbox next to each panel. Section 8, Specimen Information. Select your specimen type by clicking on the drop-down. The specimen description will auto-populate. Select the container type. The container description will auto-populate. Select the date of the collection using the calendar and the collection date and time. Change the time as necessary. Enter the name of the individual who collected the sample. Select all attached tests available. If the patient is unable to give a sample at the time of their visit, select the at-home checkbox and our lab will mail a self-collection kit directly to the patient's house. With this, the collected checkbox should not be selected and the collection date and time should be left blank. Section 9, Results. If the ordering physician would like to see variants of unknown significance on the report, select the checkbox. Section 10, Clinical Information/Justification. Enter any notes the ordering physician documented during the patient's visit to indicate necessity of the testing. If it is easier to upload the medical progress notes directly from the EMR, select Upload Clinical Documentation and add the document. Select Documents as the category. When the requisition is finished, and select Submit to Lab. Once an order number is generated, the order has been successfully submitted to the lab. Select the requisition report to view the completed requisition. Print the completed requisition and place it in the outside sleeve of the sample's biohazard bag. To return to the dashboard, select the PMCDX logo in the header. To view results, select the Reports and Orders dashboard. All new orders will be visible at the top of the list. If you do not see a completed report for the patient, open the search criteria bar on the left-hand side of the page. Search for the patient's first name and last name using these fields. The most recent report will populate on the top. When the report is located, select the paper icon in the Reports column. A pop-up window will appear with the attachment. To return to the dashboard, select the PMCDX logo header. Feel free to reach us for any questions or if you would like to schedule a demonstration to review the provider portal.